ABC, air, breathing, circulation. CPR, abbreviation for cardiopulmonary resuscitation, is a combination of rescue breathing and chest compression. Today I will be demonstrating how to perform basic CPR on an infant. CPR is an emergency procedure performed on people suffering cardiac arrest. It is also necessary during accidents, nearly drowning, suffocation, poison, smoke inhaling, electric shock, excessive bleeding, and SID, sudden infant death syndrome. CPR can restore circulation of oxygen into the blood and the brain. According to an article by Nicole Green on kidshealth.org and U.S. National Library of Medicine, permanent brain damage or death can occur in less than 6 minutes if oxygen is not restored in the infant's bloodstream, causing the blood flow to stop. The purpose of CPR is to provide a continuous flow of oxygen to the lungs and brain until the person regains consciousness. You should perform CPR on a child 1 to 2 minutes before calling 911. Usually the baby will respond within these minutes. If not, this still allows the vital functions to keep going until emergency assistance is available to take over or the baby starts to breathe again. I'm going to perform CPR on this baby because I don't have a dummy. And yeah. Okay. So the first thing to do is to get the baby out of the car seat if the baby is in the car seat and lay the baby on a flat ground with nothing around, making sure that the place is clear. Check to see if anything is blocking the baby's airway, like licking in the mouth. If the mouth is closed, then slightly pull the jaw down to look inside the baby's air hole. If not, check for breathing. 1 second. If not, check for breathing and to see if the chest will rise for 10 seconds. Okay, let's say that was 10 seconds. The chest didn't rise and I didn't hear any breathing or feel any breathing on my cheek. Next, we do a head tilt chin lift to open the baby's airway and to move the tongue if the tongue is blocking the airway. And do 2 rescue breaths. Lifting the chin is like that, but I can't really do it on this baby. 2 rescue breaths, plugging the nose and slightly bringing it to the baby's mouth, like, because if you do too many breaths, then it's gonna be too much for the lungs since they're so small. Or you can cover the baby's mouth and nose with your whole mouth and breathe into it that way. So you do 2 rescue breaths. And then 30 compressions. The compressions needs to be at the line of the nipples, right in the middle. In between this line, between the 2 nipples, you do your compressions there. You use 2 fingers since the baby is really small, and don't put all your weight into it, but put a lot into it. And you do 30 compressions. We sing Stay Alive because it helps go with the flow. Stay alive, ha, 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 ha. And you do 30 of those. Perform this twice and then check again to see if the baby is breathing or if you see the chest rising for 5 seconds this time. The baby still isn't breathing, so then you perform that routine again. Head tilt, chin lift, 2 breaths, 30 compressions, sing and Stay Alive to keep the rhythm going. By then, give it 1 to 2 minutes before you or whoever you're with call 911 because usually the baby will respond by then. If not in those 2 minutes the baby does not respond, you go call 911. You can take the baby with you if you suspect no spinal injury. If so, have somebody do it for you. If you're by yourself, just go run and do it. And by then, the baby will be okay because the vitals will keep going because your rescue performance. It causes the baby's vitals to continue to go. If the baby starts to breathe, crying, if the baby cries, that means the baby's breathing. If after that the baby's crying, check the pulse. You check the baby's pulse either with their feet or on their arm. Make sure the pulse is normal and the pulse is okay. And that is how you do CPR on an infant.